Hello, guys, and welcome to this week's episode of the Holistic Travel Therapy Podcast. I'm your host, Courtney Condon, occupational therapist. Unfortunately, John can't make it with us today. He is feeling a little under the weather, but he'll be back next week. So you're going to have to bear with me for this week's episode. So, February is Heart Health Month, and I wanted to come with you guys on some super important facts and research out there about cardiovascular disease and its impact, as well as some things that you guys can do to decrease your risk of getting it. Unfortunately, cardiovascular disease is the leading cause of death in the United States. It affects, men, women, specifically a little bit in the older population, but unfortunately now more than ever, we're seeing it come out in even some younger individuals. So I wanted to bring this to your guys' attention. I'm sure we all know someone who has been impacted by cardiovascular disease in some way. It unfortunately runs in my family. So this is something that is really important to me. And I wanted to share it with you guys because I think that everyone could benefit from some of this information. And it might be things you already know, and that's fine. But we want to take it that step further, right? That's what we're doing here. We're building a community. We want to share it out with everyone we know. And maybe there's a few things you didn't know. There's some things I didn't know. And we can work together to implement these into our life. So also, I'm coming from a place of, I see this a lot in work. So again, I'm an occupational therapist. Some of you guys might not know what an occupational therapist is, so I thought that this would be a unique time to talk about that. As an occupational therapist, I look at what people need to do. So things like getting dressed, bathing, grooming, as well as things they want to do, or their meaningful occupations, caring for their children, playing with their children, growing up with their families that makes them the person that they are. So when I see someone in the clinic, I am looking at some of those dysfunctions. Can they bathe themselves? Can they get dressed independently? If they are a professional athlete, can they perform their sport properly and to the degree that they want to? If they're a mother, can they hold their child the way they want to? If they're a child, can they play the way they want to? So occupational therapy is amazing. We see people throughout the whole lifespan. Currently, right now, I'm in an inpatient rehab setting, so I see a lot of individuals that suffer from strokes and heart attacks. So it is coming to me right out of the hospital. These individuals have no idea, unfortunately, what their body's gone through, what residual effects may have been left because of the stroke or the heart attack, and now they have to restart all over and learn these things from scratch, essentially. So it can be very overwhelming. Thankfully, these people are the ones that made it and are not the ones that were, impacted to that extent. However, a lot of people come to me and they really don't understand how something like this happened. They're like, I don't know. I was living independently by myself. I don't know how I had a stroke. I don't know, how I had a heart attack. And even some of us who may seem really healthy on the outside, maybe not are that healthy on the inside. So that's why I wanted to kind of bring this to your guys' attention. As an occupational therapist, like I said, I see a lot of the impacts after the fact, right? So I wanted to come here today and tell you what you can do now to decrease your risk of having an incident like that happen. So when we think of cardiovascular disease, we think of those two main things, heart attack and stroke. They both are kind of impacting the brain and the body in similar yet different ways. Stroke is going to decrease blood flow to the brain, where a heart attack is a decrease in blood flow to the heart. So we can get more into the science another day if you guys want to really know more about that. I'd be happy to break it down into detail. But from what the research is saying out there now is this decrease in blood flow, whether it be to the heart or the brain, is really due to something called atherosclerosis, which is essentially inflammation of the arteries. So again, we kind of talked about inflammation like these last 4 or 5 weeks now because it is something that is so prevalent and it is a primary factor in all these diseases that we are just now realizing. Primarily from what I kind of understood was atherosclerosis is plaque buildup in the arteries. Plaque buildup is going to happen from a bad diet. And a lot of research back in the day kind of talked about, bad fats are going to increase that plaque buildup and they're going to increase your risk of cardiovascular disease, which is true. Bad fats are going to do that. A huge risk factor in increasing your risk for cardiovascular disease is an unhealthy diet. So that's going to be something that is high in those refined carbohydrates and processed foods, low in fruits, vegetables, just whole grains, fish, nuts, and increase in sugar and excess sodium. So those are the things that we really want to be aware of when we are thinking about that diet. If you guys haven't already listened to our episode specifically about nutrition, when you're done with this one, you can go ahead and listen to that one so you can get a little bit more in depth. But overall, the research is saying that Mediterranean diet that we talked about a few weeks ago is huge in preventing your risk for cardiovascular disease. So that is a diet that is primary with olive oil. So that is going to be that good, healthy fat that you can use to cook with, you can use to bake with. There's a lot of uses. Use it as a salad dressing. The oils that we want to stay away from are going to be like your canola oils, your vegetable oils. Those are unfortunately highly processed and they're not going to give you that same healthy, nutritious benefit as olive oil, avocado oil, coconut oil. So just making sure that we have that understanding when it comes to these healthy fats and that impact on your body. So when a research study looked at the impacts of that atherosclerosis or those inflammatory markers, things like interleukin 6, they saw that those numbers, if they were higher, regardless of the individual's cholesterol level, led to a increased risk of a cardiovascular incident. So that was really interesting to me because that was something that I thought was so important. Like, make sure that you have a good cholesterol level, so you could decrease your risk of that. And I'm not saying that that's not the case. Again, I'm not a doctor. I'm not a nutritionist. I'm just specifically citing what this research article said that has to do more with inflammation and that's impact on our arteries, therefore leading to these events. So don't forget, guys, all of these studies will be referenced in the show notes, so you can go ahead and look at them yourselves. Another big thing that specifically that article talked about was then these pro-inflammatory types of things that we can ingest to reduce our inflammation. One of them is selenium. The other one is zinc. Vitamin C and vitamin E is what they talked about, that if they are deficient in the diet, you're going to have an increased risk in a cardiovascular incident. So selenium is something I feel like not a lot of people hear about, talk about. I primarily know it from Brazil nuts, which is a great source of selenium. Shout out to my mom. She probably a few years ago now was like, Brazil nuts are pretty much like nature's baby aspirin. So it helps to, decrease those inflammation and keep the good blood flowing through the arteries. So selenium comes from Brazil nuts. It also comes from chicken and cremini mushrooms. So I guess that's a specific type of mushroom. And then, like I said, zinc. So zinc is going to come from your meats, your dairies, your dark leafy greens, as well as dark chocolate. So that's why sometimes people say that if you are vegetarian or vegan, you might have a zinc deficiency. And that is maybe when you want to consult with your doctor about if a supplement is right for you. Vitamin C, I think we all think of citrus fruits when we hear vitamin C, but actually kiwi has a lot more vitamin C than citrus fruits. Strawberries also have vitamin C, as well as some other fruits and vegetables. And then we have vitamin E. So that is going to be found in your nuts and seeds. So olive oil is going to have that vitamin E as well as array of nuts. So that kind of goes back to that Mediterranean diet. A lot of those things that we just talked about are kind of already built into that diet. So that's huge. I think number one way to reduce your risk of cardiovascular disease, guys, is going to be to focus on that diet. So remember, think about decreasing your intake of highly refined processed foods, as well as high sugar intake and excess sodium. So a little bit of salt here and there, that's perfectly fine. When we think of excess sodium, it's going to be a lot in those like pre-packaged meals. So try to just cook your food. There's also ways that you can look for lower sodium options. And then we're thinking about increasing our intake of fruits, vegetables, um, good sources of protein, whether it be red meat or white meat or fish, and then getting in some of those healthy oils as well as some nuts and kind of making it all together. So if you guys ever have any questions about what type of meal would kind of combine all those things, again, I am not a registered dietitian. I can't subscribe or provide you with a meal plan, but as a community here, we can always give you guys some information on what maybe a salad you can make or a healthy dish that incorporates multiple things. So the second thing when we think about our risk for cardiovascular disease is going to be inactivity. So now more than ever, I think unfortunately we are heavily relying on just being sedentary. We wake up in the morning, we feel great, we sit in our car as we drive to work. A lot of us sit for most of the day when we're working, and then we get up and we drive back home. We maybe, walk around the house, clean the house, we're doing our things, but then we go and sit on the couch for a while and watch TV before we fall asleep and do the whole thing over again. So think about how much time you're really spending up and moving and being active. The US recommendations for physical activity right now is 150 minutes of moderate physical activity. So, an easy way to think of that, 150 minutes, if you did 6 25-minute brisk walks a week. So, we kind of talked a little bit about that in a post that I posted on the page last week about ways you can listen to the podcast. I'm going for a walk, right? So you can maybe listen to a podcast when you're walking. Maybe you can invite friends and family. So it not only benefits you, but it benefits other individuals. So thinking about things like that, maybe walking's not your thing and you want to ride a bike or go rollerblading or you want to play a sport. Anything that's going to elevate that heart rate a little bit. If you're doing moderate vigorous activity, you do it for less amount of time. So 75 minutes is what they recommend. And then they are recommending at least 2 days a week you're doing some type of muscle building activity. So whether that be weight training or using resistance bands or even body weight things. So that's super important because we know that as we age, we have an increased risk of losing muscle tissue, and muscle tissue is so important to maintaining our strength and decreasing our fall risk. And so we really want to think about those things when we are going into our everyday life. And like I said, sometimes we just don't realize how much we sit and we don't move. So maybe when we get home from work, we could take the family outside and we could throw the football together. Or we could go for one lap around the block. It doesn't have to start off big, guys. Every little bit counts. Maybe you're more into yoga. Yoga's great for strengthening. A lot of people think that it's mainly flexibility work, which there's a lot of flexibility work built into it, but you do have that body weight muscular component that is huge. So yoga is amazing. Like I talked about in the first episode, you guys can find some things online. So there's so many resources out there. I understand sometimes you don't know where to start, and sometimes group exercise classes can be overwhelming and scary. So maybe start small, going for a walk, taking a friend, having some leisure conversation and moving, and then you can always expand from there. I think it's just getting started is what's so hard. And then once we find that routine, it just makes sense and we can fit it into our everyday lives. I know some people like to exercise right after work to kind of decompress from the day. I personally like to exercise before work. I think it gets me in the right, mindset, and just I feel great after a workout, so I want to do it before I go to work so then I can give my best self at work. Since like I said, I'm working with a lot of complex patients and individuals, I want to be mentally and physically at my best. And I think that you guys would want to do that too. So whether you are, younger and you're still working, or you're older and you're retired, there's a lot of things that still go on every day that you want to feel your best for. So, number 2 way to decrease your risk of cardiovascular disease is going to be to find that activity. But we want to make sure that we understand that any type of activity that increases our heart rate is a tiny stress on the body. So, this brings me to my third way to decrease your risk of cardiovascular disease, and it's going to be stress management. So, a study I found talked about the effects of quarantine from the coronavirus and its impact on cardiovascular disease. So, they did talk a lot about the fact that the overall people were not as active because of gyms being shut down, because they weren't going outside their house to get to work and things like that. As well as it was noted that since the grocery stores were, limited, that they had a less of a availability to get to those healthier food options. So those things were a separate. This specifically talked about the impact of the stress from quarantine on our bodies. So, whether it is a run because you love running, or a run because you're running from a lion, your body looks at that stress the same. Now, if we don't necessarily have that positive mindset of like, hey, I love this run, I'm doing this run because it's good for my body, then even though we have that stressor, there's research that shows that that positive mindset decreases its negative effects on the body, versus if we're running from a lion and you're thinking like, oh my gosh, this is miserable, I'm about to die, that is going to have that negative impact on your body, which is going to lead to your body taking in that stress differently. So unfortunately, a lot of us, I mean, I definitely felt like this a little bit over quarantine. I was like, this is bad. This is, terrible. I'm isolated from my friends and my family, and this sucks. So, that chronic stress of never knowing when you were going to be out of quarantine, when you might see your friends and family, if your friends and family was safe and healthy, that stress impacted our bodies in so many ways that the scientists are just now starting to understand that it directly increased those inflammatory markers within our body, and therefore increases our risk of cardiovascular disease. So it's so important, guys, to take a few seconds a day and just be mindful and present, whether that's a meditation practice or not, even just being grateful and, saying a prayer or telling the people that you care about how much they mean to you. That is reducing that inflammation in our body. That is decreasing those inflammatory markers, that interleukin 6, all that stuff, guys. It is bringing it down. So, that is going to be that number third way of decreasing your risk for cardiovascular disease, is going to be about stress management. So, like I said, I think that we sometimes are so, and I'm speaking personally, to be honest, we are so focused on trying to do everything, right? We have to have a clean house. We have to, you know, eat healthy. We have to exercise. We have to be social. We have to work. We have to, relax and have fun. That we are constantly putting a lot of pressure on ourselves. And sometimes we just need to slow down, take a few moments, think about what we're grateful for, and really reduce that stress. So, going back to that study, that those days and weeks and months of chronic stress impacted those, again, arteries by increasing that inflammation, which then unfortunately led to higher risks and higher increases in cardiovascular disease. So taking that time, guys, it is so important. It is more important now more than ever because we we're inundated by tiny stressors. I drive 30 minutes to work every day, and that is not even that long compared to what I know some people do. And that stresses me out. So, really trying to figure out ways that I can decrease my stress, be a little bit more present throughout my day. Sometimes I'm so focused on providing for my patients and making sure that everything is getting done that I'm sacrificing myself. So I feel like you guys might be in the same situation. If you are, please, we're here to work as a community to decrease that stress and to live healthier and happier lives together. So, one other big thing that I wanted to talk about in that terms of meditation and relaxation, stress management has to do with grounding. So, if you guys haven't heard about grounding, the research is starting to come out about it. Grounding is essentially what it sounds like. You are putting your bare skin, your bare feet, bare hands on the earth. This is increasing that blood flow in ways that scientists are just being able to understand. And it is having profound impacts on our body, our mood, our circulation, all that stuff. So, a few studies were conducted, and they took participants, and half of them did the grounding protocol, the other half did not do the grounding protocol. And this was specifically focused on stress management. They found that through blood markers. So again, when I talk about all these interleukin 6s and all these pro-inflammatory markers, they found that through blood tests, the individuals that did the grounding were less inflamed and therefore leading to lower risks of cardiovascular disease. So that is huge, guys. How simple is that? To get outside for a few minutes a day and stand barefoot on the ground. Another study focused on the impacts of grounding for overall muscle soreness as well as um, and inflammatory stress markers, things like that. So they looked at creatine kinase. That's how you kind of see about that muscle soreness post-workout. Pain management, I think, was another big thing they talked about, as well as those inflammatory markers. And again, through blood tests. So they literally have the data right there, and then they showed that the individuals that did the grounding compared to the individuals that did not do the grounding had decreased levels of muscle soreness, of pain, as well as inflammation. So that's huge. That's really big. And I think that is something that's so simple to implement in your daily activities. And it doesn't have to be every day, but definitely trying to get it in a few times a week is going to be great. So I think that kind of brings me to the end of this episode. I appreciate you guys hanging out with me for the last 20 or so minutes. And like I said, cardiovascular disease is, decreasing the incidence of that is something that is so important to my heart. And I'm sure we all know someone, whether it is in our family, outside of our family, a friend that has been impacted by cardiovascular disease. So my challenge for you guys this week listening to this episode is to share out this podcast with maybe someone who needs to hear some of these things. I hope I articulated it in a way that is understandable as well as engaging so that you feel comfortable sharing it with your friends and family and they get to have that benefit as well. So that is my challenge for you guys this week. Again, remember those 3 things, we're going to bring them back. Is the first one is going to be your diet. The second one is going to be physical activity. And then the third one is going to be stress management. So I think we're starting to see that those 3 things impact a lot of our chronic diseases in the United States. So really just honing in on some of the things that we talked about today is going to help tremendously with that. As always, guys, if you have any comments, questions, please comment below. Let us know. Also, we want to hear from you, right? So maybe what are some things that you've been doing to, if heart disease runs in your family, if heart health is something that is close to your heart, what are you doing to put yourself further away from acquiring one of those chronic diseases and closer to that optimal health that we all desire. So let us know, guys. And thank you again so much for tuning in. Share this episode with someone that you love that would benefit from this information. And we will see you next week. Have a great one.